Why don't we get started, folks? It is now top of the hour, and it is my honor to introduce our speaker today, our very own Jeff Katzman. As we all know, he is the current Vice Chair of Education and has a number of previous roles within the department, Vice Chair for Adult Clinical Psychiatry, and so on. In addition, he's also the Director of Education at Silver Hill Hospital in Connecticut, and he is the Medical Director of Project ECHO, First Responder Resiliency Program. As we know, Jeff is nationally, globally known for his expertise in psychodynamic psychotherapy. As we know, many of our residents come to our program thanks to Jeff. And he's also an author. I guess in his passport, he could say psychiatrist or author. And I understand a new book is coming out. He's really quite good at writer. So today he's gonna be focusing on the effects that climate change has on mental health. And we've mentioned that he's working with Project ECHO, focusing on resilience. So we're very much looking forward to welcome my dear friend, distinguished faculty member, Jeff Katzman. Jeff, please.
Thank you, Mauricio. Thank you so much for this opportunity. And thanks everyone who logged in early for bearing with me to play a little music to warm up. And put us in a little bit of mood, a little bit of nice sounding music before I give a more apocalyptic kind of talk today. And I gave an apocalyptic talk last year about The Walking Dead. So I was just seeing Dr. Waldorf in her office saying, I don't know what's up with me, but that seems to be where my head is. And I think same for many of us. So I'm gonna go ahead and share my PowerPoint and see if that, everyone can see that okay? Yes?
Yes, we can.
Thank you. Thanks, Sally. Okay, so I am, as Dr. Towen mentioned, going to speak about the mental health impact of climate change and really start to conceptualize our role in that. And before I get started, I wanna say a little bit about how I got into this. I have no disclosures, no conflicts of interest. I haven't really done much in the world of climate change. I'll say when the pandemic started back in January of 2020, I said to my daughter, who was in Manhattan, going back and forth on the subway, you know, Jack, you really shouldn't be on the subway right now. It's getting a little bit scary. And she said, oh, Dad, that's your generation's anxiety. That's your version of our climate change anxiety. At which point I kind of woke up a little bit and we started a conversation. And my kids, as well as many residents and students here, have been progressively waking me up through conversations about climate and climate change and the importance of it and the importance that my generation take it very seriously. So I happen to be married to somebody who has taken that very seriously. And my wife, Joanna, has went ahead and got certified through Yale as a climate change communicator. They have a course in climate change communication at Yale. And she's done quite a bit with Project ECHO. And she has started a climate change and human health communication program that meets each week. And there you can just look that up and you'll run into it. It's on Wednesdays every week. So for anybody who's interested, that's a collaboration between UNM and NOAA, many federal agencies with hundreds of people online learning about how to talk about climate change. I spoke on there and am now, because of that and because of that opportunity, have quite a bit of knowledge in the area of mental health in general and climate change and what it means. And what I'd like to do is to discuss some basic facts related to climate change, just a little bit of what we know, which is a lot, and then understand threats to mental health as a result of climate change and start to delineate some individuals who are at greater risk and some specific prevention strategies, sources of resilience, some treatment Yeah, so that is what I'm going to do along the way. And this is a graph from this week. Many of us saw this graph. I was in New York watching this graph. This is the COVID Omicron spike that has been in the news. And you can see back in 2020, when things were horrific in New York, this was the number of viral cases. And this is when it was up to about 40,000 in the third week of December. And we can just see how this virus is spiking. And it got all of our attention. And if you turn on the news, that's what we mostly heard about. But I heard about a few other disturbing things in the news that same week, so 2 weeks ago. It turned out there was this news clip that Alaska had recorded a record high temperature of 67 degrees on that day in December, which was actually 20 degrees Fahrenheit higher than any other prior day ever that year. There were there was a lot of news international around the Colorado fire in Boulder, and this heading said up to 1,000 homes burned to the ground as Inferno declared the most destructive ever. And then I watched a news clip about the Doomsday Glacier, which I'm finding myself talk about in various settings. On the Doomsday Glacier thread, it seems there's a glacier that is melting at a rate much faster than anybody predicted, that is likely going to melt in the next 10 years if nothing changes. That they predict that the seas will rise 10 feet as a result of the melting of the Doomsday Glacier. So in my venture in understanding climate change, here's a little bit of what I've learned. There was a national climate assessment in 2018 in which those experts said that it's extremely likely that human activities, especially emissions of greenhouse gases, are the dominant cause of observed warming since the mid-20th century, and that they will result in extreme weather events, global warming due to continued burning of fossil fuels at an accelerated pace, and marginalized and vulnerable populations will be affected the most. So if we take a look at CO2 emissions, you can see the pink line here, back to 1750, is total atmospheric CO2. And you can see it start to rise in 1900, 1930. And underneath it, the blue line is the CO2 emissions. And we can see this sharp slope there starting in around 1960 and what that's done to the total CO2 in parts per million in the air. By industry, that's driven by these factors: steel, cement, and plastic, 31%, followed by electricity, agricultural, transportation, and heating are the major CO2 emitters. And we can see here just the rise in CO2 emissions that peaked at this point of this graph in 2018, but continues to rise each year. So what does it really matter? Well, we can see here that as CO2 emissions rise, where we see in the left box, so has temperature begun to rise. Observed, that's the black line there of observed temperatures. And then those are three different lines of modeling that they call representative concentration pathways, or RCPs, that show what happens to temperature given different modeling of CO2 emissions. We now know that globally average annual temperature has risen by about 1.8 degrees since 1880. And if you go on the NOAA website, you can model different counties and put in a county, although I put in Bernalillo County and it doesn't come up. But if you come But in Sandoval County, you can see the modeling of predicted temperature rise given CO2, predicted modeling of CO2 emissions. So currently, the world's stated goal from the Paris Climate Agreement in 2015 was to limit global warming to no more than 2 degrees Celsius. But it was actually following that, an Intergovernmental Panel on Climate Change warned that actually 2 degrees wouldn't be considered safe and suggested 1.5 degrees as a more prudent goal. But regrettably, we have not even come close to the 2 degrees, much less to the 1.5 degree warming goal, with current models projecting 3 degrees of warming as more likely outcome in the years ahead. So when we think about the pandemic, when we think about mental health, we know there's tremendous costs and an increased utilization of the healthcare system just from what we're going through now, with huge mental health impact that we're all dealing with. Unlike the pandemic, though, for what I'm talking about now, there is no vaccine and there are no masks that will flatten any of these curves. And it's going to take tremendous efforts and integrated systems taking a look at that. A lot of what I'm talking about, if you're interested, I'll make this PowerPoint available, and the references are on most slides and also at the end of the talk. The complexity is that in terms of the benefit often comes in the distant future and is globally distributed is the general feeling. So it minimizes the motivation for any specific community to take actions to limit carbon emissions very seriously. And also additional policies have been quantitated to really be important to also help in limiting carbon emissions, including improved food systems, including the infrastructure, land use practices, access to family planning service, and education of women and girls across the world. The silver lining is that any city or state or nation that shifts to renewable energy will immediately realize the benefits from cleaner air, water, healthier people, and reduced health costs and enhanced GDP. And the University of Wisconsin modeled this to say that if they were to move across the state to meet 100% of their energy needs with clean renewable energy, it would increase the net jobs by 161,000, increase the state GDP by nearly 5%, increase state tax revenue by more than $500 million a year, and avoid human health damages that cost more than $21 billion a year. Those are just some facts about climate, what's happening. The folks at NOAA, the people on the climate change echo call that I referenced can get into that much more. I'm really going to focus now on what we do on the impacts of mental health and awareness that I really think we all need to have about how our changing climate impacts mental health. And it does so through extreme weather events, chronic climate changes, anticipation of climate changes. It does that with vulnerable populations. There are personal characteristics of individuals at risk. It does so particularly with children. And there are coping strategies that are effective and harmful. There is a need to build both personal and community resilience. And there is a very great role for healthcare providers to play and effective communication strategies when talking about these issues with our patients. And all of that is what I would like to talk about right now. Starting with the single events. So it turns out that in 2020 alone, all of those were considered billion-dollar climate events, the frequency of which has quadrupled since 1980. These extreme weather events, I'll go through them more individually, but taken as a group, include things like heat waves and wildfires and floods and hurricanes and tsunamis. In one single event, of course, poses less risk to our mental health than repeated incidents, and really does put somebody at risk though for PTSD and adjustment disorders and mood disorders, substance use disorders, sleep disorders, suicidal ideation, and attempts and completions that I'll get into when looking at these events more specifically. Interesting though, the reaction to specific kinds of stressors like this, specific kinds of billion-dollar disasters, might have their own unique features. And just like some have actually suggested a specific COVID-19 stress syndrome in which people worry about their personal health, their finances, that there's a degree of xenophobia, that there are traumatic stress symptoms and compulsive checking and reassurance seeking that might be different than anything that we currently have in the DSM. We also know that these big disasters lead to difficulties with coping strategies, and often that involves substance use. It often involves migration and leaving your home. It often involves not enough time or resources really to grieve what has happened, and a distancing from what is familiar from other people, and a general development of pessimism about the future. It often involves financial hardships, loss of business and demand for products, and insufficient food and water and infrastructure, and really displacement from what is familiar and the stress of new environments that are often temporary and barely habitable, with enhanced risks of infection, particularly now during a pandemic, and the exposure to new languages and cultures and prejudices and biases, all which impact the mental health of people who are forced out of their homes as a result of these big disasters. So about 25 to 50%, depending on the studies you look up, will experience negative mental health outcomes as a result of these single episodes. They'll generally diminish over time, but not for everyone. The risks are greater given a greater magnitude of the traumatic event, exposure to the injury or death of a loved one, female gender and younger age seem to put a person at greater risk for the development of these symptoms, lower socioeconomic status, less education, and minority or ethnic status, and access to resources also place somebody in greater risk to develop symptoms as a result of these stressors, as does psychiatric history, family instability, and inadequate social supports. Residents of low and middle income countries are especially vulnerable to the outcomes I'm talking about, as they have increased exposure to extreme weather events, high levels of poverty, and lack of access to services. So what I'd like to talk about is some of these different billion-dollar disasters and single events, and what we can expect and what we can think about how they affect our patients and how we might communicate about them. So there was a day in June of last year that was extremely hot on June 16th, and there was a weather map that I saw, a heat map that I saw. They said that was unlike anything that they had seen in recent years, and looked something like that. And you try to find New Mexico there, you know, it was hot, very hot, even hotter than we were used to. But it turns out there's really a disparity of extreme heat problems, in that low-income neighborhoods and communities with higher Black, Hispanic, and Asian populations experience significantly more urban heat than wealthier and predominantly white neighborhoods within a vast majority of the United States. For 71% of counties looked at, the land surface temperatures in communities with high rates of poverty can be up to 4 degrees Celsius or 7 degrees Fahrenheit warmer compared to the wealthier neighborhoods during the summer months. The same is true for minority communities across the country compared to their non-Hispanic white neighbors, even when controlling for income. And this is really due to increased man-made surfaces, higher density of populations, and less vegetation in those communities. And the American Psychiatric Association has begun to take this quite seriously and issued a statement that said that while many people are still coping with mental health challenges from the pandemic, exposure to extreme, even unprecedented heat can worsen psychiatric symptoms. The APA believes that the impacts of climate change, such as these extreme heat waves, pose a threat to public health including mental health. So we look at some studies specifically about the impact of heat on mental health. Very interesting. There was a study in China that showed an increase in outpatient hospital visits for mental health on days of extreme heat. A study in Australia showed that the admissions for mental health increased by 7.3% when the temperature was over 26.7 degrees Celsius during the years 1993 to 2006 when this was followed. It's also very interesting to me that people with mental illness are 3 times more likely to run the risk of death from a heat wave than those without mental illness. People who are pregnant during heat wave run the risk of lower average birth weight and increased incidence of preterm birth. And there is obviously reduced schooling and economic activity during extreme heat waves, increased behavioral problems, and lower measured IQ across certain populations during extreme heat waves. High temperatures have been shown to be associated with increased incidence of major depression. These are some very interesting studies when I looked at them, that higher temperatures than usual, especially in June or July, are associated with an outbreak of aggressive crimes and massive increase in shootings. And heat waves are associated with greater collective violence, often through the mechanism of diminishing resources like drought. Also interesting in what I learned about some of our patients are that our antipsychotic and antidepressant medications can interfere with temperature regulation and increase the risk of heat stroke, actually. And also individuals with schizophrenia may have greater difficulty due to the process of their illness compensating for heat stress, compounded often by diabetes from some of our medications, which puts an individual at greater heat stroke risk because of an interference with glucose metabolism. And then we know that many of our patients with schizophrenia who are homeless often are at risk for exposure and dehydration simultaneously. There was an example in San Francisco, which also caught my eye, that it turns out that the average household urban water use is about 158 gallons of water a day. And the recommendation for the maintenance of a sanitary lifestyle is about 50 liters a day. The access necessary during times of emergency is 16 liters a day. That's the UN published standard. But the 2021 Coalition of Homeless report showed that in San Francisco, which is an example, greater than 60% of the homeless don't meet that 16 liters a day standard. And the water filling stations in San Francisco tend to be almost exclusively on the west side of the city, far from the homeless encampments in the Tenderloin, Bayview, and the Mission. So as we assess people and we're meeting with our patients, there's a lot of things we ask now that we didn't used to ask. We ask about car seats, we ask about seat belts, we ask about guns in the house, we ask about vaccination. And what I'm suggesting is that there may become a time, and it may be right now, that we may want to consider asking about the way the climate is affecting our patients, and to share the risks and symptoms of dehydration and heat exhaustion and heat stroke so that our patients know what those are. Wonder with our patients about how they stay cool and find shade and get water. Discuss about how diabetes puts our patients at risk. Wonder with our patients about the impact that heat has had in their life, and if they have had different feelings of anger or other kinds of feelings at times of extreme heat, and if they've noticed those changes historically. So if we look at the impact of flooding around the world, it is also associated with PTSD and other major mental health disorders, even in areas that have not been flooded but are adjacent to the flood. There are the greater intensity of these events are associated with higher levels of PTSD, and drowning and electrocution are the most direct cause of loss of life, leading to PTSD for survivors. As I mentioned in the prior slides, flooding often leaves families, individuals forced to migrate. They face loss of loved ones, damage to the infrastructure, diseases, overcrowded facilities, and loss of access to mental health resources, all putting a burden and increasing mental health issues. And community preparation is shown to be vital in developing a sense of resilience in areas prone to flooding. And this is not necessarily a New Mexican problem, but in areas where flooding is a risk, it is a good idea to talk to patients about how they've prepared for a next event. Do they have the medications and supplies they need if they were forced to leave home? Do they have insurance if that was relevant for them? And any issues that they should think about in terms of people in their home with mental health conditions and what would happen in the case of a flood and having to leave their home. We know that in events involving wind, hurricanes, tornadoes, there are increase in rates of cardiovascular disease, increased rates of prenatal maternal stress and depression, that infants are more likely to experience anxiety and fear and sadness and decreased play following these events. There's a lack of medical access during these disasters. Populations are exposed to contaminated floodwaters, and there's a consequence of material damage that often leads to substance use and mental health issues. If we look at what happened in the Hurricane Maria example, 26% of those in that area expressed suicidal ideation at that time. There were additional consequences involving like many hurricanes, involving the loss of social support, job insecurity, loss of belongings, as well as a disruption of the medical system, displacement and relocation. There were consequences of the lack of power for extended periods of time, and mental health disorders were seen often 1 year after Hurricane Maria. 1 in 6 people developed PTSD, half of them developed anxiety or other mood disorders, including depression. And we would want to, if we lived in an area where there were wind events, we would want to think about, do you have a place to go? Does your family have a communication plan in the event of lost power? Have you prepared to get out quickly? Are there issues with your home that should be considered, like trees? And are there individuals with mental health conditions that should be talked about about potential plans? Fire, another one of the billion-dollar disasters, has also puts people at risk for general mental health problems, which can be delayed in onset and also persist for several years. A study of the Australian bushfires 1 year following those, 42% of the population that was exposed were classified as having psychiatric issues. In the California wildfires of the last couple of years, 33% in one study had shown symptoms of major depression and 24% of PTSD. So the relationship between climate change and disease is becoming a little bit more clear. We don't really know if COVID-19 is in any way related to climate change, but there is an anticipation of new disease vectors associated with climate change. This 2010 Quadrennial Defense Review said that the Pentagon actually officially recognized climate change as a factor worthy of consideration in national security planning, saying that warmer temperatures can also exacerbate the introduction and proliferation of heat-related illness and disease vectors, such as mosquitoes, into vulnerable regions. The 2014 Climate Change Adaptation Roadmap warned of the emergence of new strains of disease, and that climate change is a threat multiplier that will aggravate stressors abroad, meaning that in areas around the world, that are more prone to the development of disease as a result of climate change, that becomes a security threat that the Pentagon is now considering. The leader of the World Health Organization in 2017 said that as man-made climate change has taken hold over the last 4 decades, dozens of new infectious diseases have emerged or begun to threaten new regions, including Zika and Ebola. Bubonic plague spread by rats and fleas is predicted to increase with warmer springs and wetter summers. Anthrax, whose spores are released by thawing permafrost, and cold spread farther as a result of stronger winds. So what I've been talking about are kind of the epic diseases, the things that happen, the things I showed you on that map, the billion-dollar events. But we are also living with chronic climate change issues, with droughts, desertification, rising sea levels, pollution, all leaving homes at times to become uninhabitable, where people suffer a loss of place and economic instability, are forced into, at times, migration camps where there's infighting between groups for resources and deterioration of cultures and families. There's a loss of sense of connection as a result of this, in communities that are particularly involved with the meaning of the earth. Their specific ideas are challenged. I remember seeing this vividly in Whale Rider and the meaning attributed to all of the whales that had actually come up on the beach. But there is a description of specific cultures very concerned about, with fears now emerging within the cultures about things like the encirclement of the community or siege by the sea. So as the temperature rises, in each month between 25 and 30 degrees Celsius to greater than 30 degrees Celsius, for each one of those, there's a increase probability of mental health difficulties for each 0.5% over 30 degrees, and an increased suicide rate that was seen in California in 5 counties over a 10-year study, with an average of a 0.82% increase in the suicide rate with a 1 degree increase in Celsius temperatures. A 1 degree Celsius 5-year warming is associated with a 2% increase in the prevalence of mental health issues generally. Heat can have biologic impacts like suppressing thyroid hormone dehydration, causing cognitive changes, stimulation of growth hormone and prolactin, causing lethargy. And pollution is another interesting phenomenon in that there's been now several systematic reviews that found an association between the level of fine particulate matter and cognitive impairment in the elderly, behavioral problems in children related to impulsivity and attention problems. I just learned actually in another talk I was attending last week that suicide rate actually increases with levels of air pollution in both short-term and long-term exposure, as well as do visits to emergency rooms for psychiatric issues. And that may be through a mechanism in which increasing ozone levels actually interact with serotonin system. So I want to talk about something I led with here, and that is climate anxiety. So this is scary stuff that we're thinking about and really results in an existential anxiety with symptoms, particularly for those who will be more affected. And that's vulnerable populations across the globe, cultures with greater connection to the earth, and younger people who many feel that the world could end during their lifetime. In one US survey of teens, 57% report climate change makes them feel afraid. There's a term called solastalgia. I've thought a little bit about by an Australian philosopher, Glenn Albrecht, who describes a sense of chronic distress because of negative environmental changes. And from this has come some of these ideas of psychoterapeutic syndromes like eco-anxiety, eco-paralysis, eco-nostalgia. I know it affects me. We moved a few years ago, and when we moved, it was very nice. We had a really nice view of the river at the time that we moved, and a couple years later, I took a picture of the river, which of course does ebb and flow, but actually this past summer looked like this, and was at the lowest level that had been in many decades. Climate anxiety is a real thing, studied all over the world. An Australian study showing that 39% felt that, and the modal response felt that climate change was the greatest problem facing the world. And 86% of people in that study expressed some level of distress as a result of this. In a Yale study, 69% of Americans were somewhat worried, 29% very worried. In a European study, 20 to 40% described as very worried about climate change. And I won't get into each one of these. You can see though that all over the world, when looked at, anxiety about climate is real. And when I talk to people much younger than I am, they express having climate anxiety as a real entity. In fact, 85% of in a US study of 10 to 12-year-old children expressed fear about changing climate during their lifetime. So this year, there was a study of 10,000 adults around the world from 10 different countries, age 16 to 25. Those are the countries. There were 1,000 participants per country. And 59% said they were very or extremely worried, and 84% were at least moderately worried about climate change. More than 45% of respondents said their feelings about climate change negatively affected their daily life functioning. 75% said they think the future is frightening, and 83% said they think people have failed to take care of the planet. And climate anxiety and distress were correlated with perceived inadequate government response and associated feelings of betrayal. Children, of course, are more vulnerable to the effects of direct experience of climate change. The World Health Organization estimated that 88% of those impacted across the world involve children. They have a stronger response to extreme weather events, are more likely to develop PTSD, depression, sleep disorders, partly due to their greater dependence on adult family members. They're more vulnerable to heat due to their body's incomplete development, and possibly to the long-term sequela of early trauma and how that sets them up for future psychiatric issues. So I've had many conversations now with people in their 20s and 30s who wrestle with this question. I couldn't imagine we would ever be at. Why have a child? Part of that question involves why bring a child into a world that's disappearing, and people will talk about that. But there's another part, which is the burden of carbon emissions that each child brings. So it turns out that if you have one less child, you save 58.6 tons of carbon per year. That's compared to living car-free, eating a plant-based diet, or avoiding a transatlantic flights. You can see the impact, the relative impact of having one less child. And then we have the statistic that a Bangladeshi child only adds over their lifetime 56 metric tons of carbon to their parents' carbon legacy. But an American child in comparison adds 9,441 to theirs. It's gotten to the point where there's actually a movement. I uncovered and have been reading about the birth strike movement, where members have declared they're not going to have kids anymore because of the state of the ecologic crisis and inaction from governments to address this existential threat. So with all of this, what is our role? What can clinicians generally and mental health providers specifically think about that we could do? And when I think about this, I think about some different categories. I think about the role of education, of advocacy, of modeling, of preparing patients, like I've been alluding to with communication strategies, of learning from younger generations, and thinking about resilience and self-care. So we are, as I said, accustomed to talking about car seats and seat belts, vaccinations and sexuality, but we become a little bit nervous when we talk about things that we think have become political, and don't necessarily feel that it is our role. But the truth is that patients trust healthcare providers about emerging scientific information than really anybody else. Research shows that physicians and other health professionals are highly trusted sources of information around the world. And these are some studies that have examined that. And that presenting information about the health harms of climate change is an effective communication strategy that leads to enhanced issue engagement. In fact, most major medical organizations have now mandated pre and post licensure education about climate change, although most like medical schools and residencies have not gotten to the point where they've actually created that curriculum. I'm aware just personally that the American Psychiatric Association has a climate change group. So does the GAP, the Group for Advancement of Psychiatry. So does a group I'm involved in, the American Academy of Dynamic Psychiatry and Psychoanalysis, will actually devote next year's annual meeting to discussions of structural racism and climate change. And there is a really great group, the Climate Psychiatry Alliance for Psychiatrists Concerned About Climate Change. Their identifying mission is, they say, we are psychiatrists raising awareness about the impacts of climate change on mental health and doing what we can to mitigate climate distress. So there really is also our role in modeling. This one article by Mybeck says that every physician and nurse fulfills multiple roles. And we are family members, community members, professionals, and citizens. And grounded in these roles, the article argues that we should help achieve the goal of limiting global warming to no more than 2 degrees. Many health professionals are personally inclined to get involved in relevant education and advocacy activities. But we know that these extreme weather events are coming, and it's really incumbent on all of us to know how to talk about things like self-care, about communication patterns, to know a little bit about psychological first aid and about community resilience and prevention. So I'm just gonna go through some basic ideas in those areas. Ideas that many of us have learned, most of all of us, in terms of what we've dealt with in the disaster of our pandemic. We know the importance of having calm and transparent conversations, in honoring our feelings when they come up, of limiting the news, of separating work and life hours, of trying to develop some form of meaning in our lives and finding our own personal space. And when they come, identifying passivity and fatigue and doing something like exercise to help us. Most who work with people in these areas, working with patients and people who are anxious, really suggest to make a plan and to write down what will happen if. So rather than worrying in ongoing ways about what if this happens, what will happen to my grandmother, what will happen to this or that, or my workplace, to actually start to write those down, and helping our patients and people we're working with to not worry, not put the same level of attention to the worry as we do to our plan, and trying to understand and trying to focus in that direction and further flesh those out. Most of us have become skilled at talking to our patients about how to manage acute anxiety, and many of these ideas come out of, well, many paradigms of psychotherapy and meditation, and psychological first aid certainly embraces these things like alternate nostril breathing, 4-7-8 breathing, the ideas of presence, where you would name when highly anxious in a disaster, naming 5 things that you see, naming 5 things that you hear, and naming 5 senses that you're experiencing, and a good deal of data about mindfulness meditation and its contribution to resilience. Things like visualization and guided imagery and progressive muscle relaxation, of course, are helpful for all of us who are in states of acute anxiety, and we talk about apps that really do help to manage Calm and Simple Habit, being a couple of them. It's important that we're talking to our patients about relationships during these times where people can't necessarily see each other, and thinking about who the people are in their lives and reaching out to those individuals and connecting with old friends. Sometimes I even suggest to make a spreadsheet of people you're tracking in your life, just to actually remember to check in with people. And often the experience we've had over the last couple of years, it's often difficult to see older parents who've been locked in various stages of quarantine. That happens also with all of these disasters. And how do you check in? How do you make a plan about connecting when you're far away? And how do you talk to kids about this, about what can happen, about feelings that can come up during these disasters? Really important is that for all of us who are in important relationships, we're living in closer quarters than ever with changed lives and fluid feelings, and really important to help our patients and ourselves think about how we talk to each other in collaborative discourse, avoiding words like but and never and always, staying with one issue at a time, and being able to repeat back the state of mind of our partners when we're trying to feel understood by one another, and to try to take advantage of what's emerging as potentially positive in our relationships. One study of couples who did well during the pandemic, they are couples who generally demonstrate a degree of flexibility as measured by their openness to new experiences, their mindfulness to the present moments, their experiencing thoughts and feelings without obsessions, ability to maintain a broad perspective, actively maintaining connection with deeper values, and taking steps toward a goal. We've all learned, I think, from the pandemic, something that happens even more acutely in the kinds of disasters that I've been talking about. And I think it's important that we talk to our patients that when this happens, we all know how important it is to take a pause, to take a walk, to get into nature, to distract oneself. That involves cleaning or organizing or taking a shower or exercising or biting your tongue or whatever it is, to stop and take a pause from what you're feeling, and then spend time with that feeling and connecting to our feelings in whatever way works. And I've talked to so many people in our resilience program who talk about different things like singing in the shower or whatever it is to help people kind of find that way to actually connect to themselves and to their feelings. Very important is to think about how communities and teams build resilience and how we care about each other. Sophia Albert at the University of Minnesota, they developed, based on the military model, this Battle Buddy program. The University of Indiana, Kimball Richardson, has developed many peer support models there, as has Amy Athey at Arizona State, that they've written about. And a guiding principle is that in peer support systems, particularly in times of disasters, it's not as effective to bring one of us into these areas as it is to train somebody on a team actually to be in charge of the resilience component of that team, so that teams can, at the beginning of a shift and the end of a shift, check in and talk about what's going on, because it is really only the team members where trust is the highest, who can relate and ultimately care about one another. It's a good thing, I think, to learn about psychological first aid, to have some guidelines about what to do in disasters, given that, not to be apocalyptic, but it seems that they're coming with more frequency, and is helpful for us to know, particularly if we want to get involved, what to do in these times. And certainly my skills of depth psychodynamic psychotherapy ain't it. And psychological first aid is much more of a case management system where we're trying to establish rapport with somebody. And George Everly, who I've talked to quite a bit and lectured to us many times on the first responder resilience program, he wrote a children's book in which he rewrote the golden rule and said, not to treat others like you'd like to be treated, but to treat others as they would like to be treated, which is the bottom line of how do we connect and engage and get curious of another person's state of mind and listen to them, so that we can think about these 5 basic tenets, which are safety, calmness, restoring a sense of self and community efficacy, connection, and hope. And if you go online, you can get the basic training in psychological first aid, and the modules are here, are really about how to make contact, how to provide a sense of safety, to stabilize, and to gather information about what a person's concerned about and get them to practical assistance, connection with social supports, information, and then linkage with further collaborative services. I want to end really with addressing climate anxiety. And it's something actually that's an interesting difference in generations, and that my generation, I don't think, takes it as seriously generally as people in their 20s and 30s who are making life changes or life decisions based on climate anxiety. And I think it's like so many things these days, so many technologies, it potentially is a divide between parents and children if parents don't listen to their kids' real anxiety about this. And there are different strategies to address climate anxiety. There's one that's considered like problem focused, where you get involved in addressing a problem, but it doesn't tend to get to the emotional feeling involved. An emotion focused intervention is ultimately dealing with the emotions that get involved, but that doesn't necessarily address the issue. And really, meaning-focused engagement strategies are when people, particularly families, can actually engage on something that's connected to some degree of hope and some degree of action. These are involved in environmental engagement. They provide a sense of efficacy. They can often involve therapies linked to nature, but they're generally a pro-social response beyond simple activism. They involve ideas of imagining a positive future with a low carbon environment. And it's critical for children in developed nations where carbon production is higher, but the impact is lower, to become involved in this idea. And really important for parents to support their children who may be much more actively concerned about this problem. It's also an issue for us in rural environments where some of these issues these events tend to happen, and there's already difficulties with access to care, sense of individualism sometime, and people not turning to care because of gossip and a lack of anonymity and social proximity. I want to end with this, actually. We know that telemedicine is something that's grown as a result of the pandemic, and in many ways has been helpful because of an ability to provide access to care. I would add that when we do telemedicine, our patients aren't driving 4 hours to see us. And so there may be some additional thing to think about with telemedicine in terms of how we are modeling the impact to the environment. Ultimately, I turn to Maslow and his pyramid, and I think that before we can even think about the lowest level of the pyramid, we have to think about our Earth, what we're we're doing to it, how we're taking care of it, how we're modeling this, and how we're helping our patients deal with these crises. And I can make this PowerPoint available to whoever wants.
Thank you, Jeff, for such an insightful, thoughtful, provocative presentation. Always bringing new things to everybody. I too learned from first from my adult children and then from my 12 and your 14-year-old. I like the way you started the presentation, Jeff. So let's follow the etiquette. And I see that Debbie is now, we see her on screen. So if you want to ask questions, just make yourself on screen. We'll start with Dr. Delmore. I'm sure you put yourself on screen because you had a comment or question, right, Dr. Delmore?
Thank you, Dr. Towen. Thank you so much for this talk, Dr. Katzman. That was fantastic. I just wanted to comment that I was really inspired by your talk. I find that you are an outstanding role model for us, and you often find the next important topic, for us to kind of have our eyes on. And this is something that, of course, caught my eyes when I was much younger, and then I kind of lost sight of it as I was building my career and my life. And a couple of years ago, I read about it in some of the APA's publications about the formation of this task force or committee, I think it is, looking at climate change and how we as psychiatrists can support the health of our world. So I just think it's really important stuff. And it was a great presentation to kind of have you look at it from different aspects. I guess I don't really have a question, but it's not really well formulated, but I'm wondering how, I liked how you gave us ideas about how we could do sort of problem-focused, meaning-focused advocacy versus feeling-focused management of things. But I just find that it's difficult to navigate that. When you want to do something, but sometimes we feel a little bit powerless as to where and how to start with this, and yet we don't want to avoid it or ignore it. So I don't know if you have any comments about good places to start.
Thank you so much. No, thank you for the kind words. I really, really appreciate it. I was talking to Kathy Frazier this morning in clinic about this a little bit, and we were kind of remembering when smoking was something you wouldn't necessarily talk about to patients with, because it was maybe something preference and you shouldn't get in somebody's way, but actually then smoking was kind of understood as a health hazard. And I guess the thing that I'm saying here is this is no longer political, this is science. And so it falls to us as advocates of science, I think, to think about how we assess, how we think about it, how we advocate, model. And obviously one of us can't do anything about it, but I am starting to think, like when I do a telemedicine session, I just saved a car ride. There are certain things that added up together. And I don't know, at the urgings of my children, I became vegan a few months ago. I think there's lots of things that we can do and wonder about ourselves as living in a place where actually the disasters are going to happen less. To help the rest of the world, and I think this goes to asking about vaccination status, which has become politicized, but actually we become advocates of science. I think we have to kind of take the end of our world as something that maybe we can't stop individually, and we'll take a worldwide cooperation, but we can at least feel better if we know that we're putting ourselves out there. That's kind of how I would think about it.
We have time for at least one more question. Any last words, Dr. Katzman, on your part?
No, just thanks for letting me talk. Thanks to the many residents I've had conversations with this about, who've opened my eyes to how we grown-ups or grown-ups learn about how to be in the world from people who are younger than us. I think this is the primary issue at hand.
Thanks again, Jeff. This presentation was obviously very much valued by many. Thank you much.
Well, thanks, Marisa. Thanks, everyone.